Okie dokie. So if I am the one who is having a nosebleed, I may not need PPE because I am exposing myself to my own bodily fluids. However, if it was somebody else, I would put on a proper PPE. I would put on gloves, I would put on eye protection, I'd put on a gown if I need to. Probably wouldn't need that for a nosebleed unless it was super severe. But for sure, make sure that I have appropriate PPE and make sure that the scene is safe. So if I'm the one who has a nose injury, what I'm going to do is I'm going to make sure that my head is tilted forward. I'm going to take a bandage, some sort of clean cloth. I'm going to pinch right underneath the hard part of my nose, right where it's soft. Take that here and pinch. Make sure that I'm leaning forward. You don't want to lean back. And you do not want to tell your patient to lean back. Make sure that they're leaning forward. So we're going to pinch and hold for about 5 to 10 minutes and then reassess and make sure that bleeding has stopped. If it has not stopped, then we need to make sure either that we are actually leaning forward, that they're sitting upright if for some reason they started slouching back, or we may just need to transport because this may be more serious than we realize. We're going to make sure that we reassess our airway condition as well, make sure that they're not aspirating blood or anything like that, and make sure that the bleeding has not gotten worse as we attempt to stop the bleeding. Same basic principles apply if it were myself or the patient, except for with the patient, you're going to be coaching them through to make sure that they are leaning forward. Maybe you will be pinching that bandage. Maybe you can have the patient pinch that bandage if you think that that's appropriate, if they are a willing participant and you would trust them to actually hold it appropriately.